Hello, everyone, again. This is another episode of Anatomy for Massage Therapists. But if you're not a massage therapist, feel free to tune in anyway. So, yes, we're going to look into another section of the body here. We're going to look at the pectorals in particular, pectoralis major and pectoralis minor to be exact. So, if we were taking a look at the anterior portion of our body, we look at the chest, or we could actually consider this the anterior shoulder. The most superficial muscle that everybody always looks at, that's the pectoralis major. It's the one that is always looking good for show. People want it to look nice on them, especially the boys. And that is the muscle that is going to be dominantly responsible for a lot of movement in the shoulder, at least anteriorly, that is. So we got flexion of the shoulder, moving your arm up and forward. And then we also have adduction of the shoulder as well. So if you had your arm up out to the side, your arm would come back down to your body. That would be adduction of the shoulder. Pectoralis major also assists in medial rotation. It's going to move your shoulder inward, in other words. Medial rotation, uh, I believe there's another term for that. I think it's internal rotation. That'd be it. Now, pectoralis major has three major sections where it would originate, where it attaches, in other words, so where it starts. One would be, as you can see here, this would be the clavicular attachment, goes to the clavicle, which would be your collarbone. And you can see here, there's like a midsection. This would be along the sternum, or some people would refer to this as the sternocostal portion of the pectoralis major. Costal meaning ribs, by the way. So it attaches there. And then you'll see this lower section here, sometimes referred to as the abdominal section of the pectoralis major. It doesn't actually, go into the abdominal section per se, but it does attach there along the ribs again, or the costals, via an aponeurosis. An aponeurosis is a long, flat sheet of connective tissue. It serves sort of like a tendon, if you will. Now, all three of these sections here, all three of these origins, they all have a common insertion point. They all go to the intertubercular groove, which is found in the humerus. It's between the greater tubercle and the lesser tubercle, which would be found on the humerus, right? And so it just fits right in between those two bumps there, again called the intertubercular groove, sometimes also called the intertubercular succulus. And this is how it's able to move your shoulder in those three functions that I mentioned earlier. There's the shoulder flexion, shoulder adduction, adduction, then also medial rotation. Then here we have pectoralis minor. So if we were to rip off pectoralis major right underneath, we would find that, and it's one of the scapular sling muscles. So if you were to find its origin, it is found on ribs 3 through 5, or costals 3 through 5. And then it goes all the way up to the coracoid process on the scapula. That's its insertion point. And what it does for the scapula, it's stabilization, also protraction of the scapula. It's going to help with depression of the scapula as well as um, downward rotation. So when you're doing your push-ups, as exhibited here by this guy, you have your pectoralis muscles to thank for that. It's going to keep your shoulders stabilized and in motion there. Also, when you're doing the bench press, it's a pretty obvious one, but just to give you a clear indication of what the full effect of shoulder flexion, shoulder adduction, as well as medial rotation looks like. Yes, you're doing all of those things when you're performing a bench press. So be good to your shoulders, treat them well, because without them, it'd be very hard to move. So hey, if you liked this video, if you found it informative and it helped you out, please like and subscribe. It means a lot to me. I do put a lot of work into this content. So thank you again for watching, and please stay tuned for more.